Scene.
Hi, my name is Rachel Eddy, and I will be your student nurse practitioner today. I have that your name is Maverick, is that correct?
Yes.
Alright, Maverick, today we're going to be doing a focused exam on the musculoskeletal system.
Okay.
First, I'm going to go over your vitals. Maverick is a 25-year-old male. He has no acute distress, normal affect, well groomed, mood is appropriate. He's 5'8", weight 200 pounds, respiration 16, heart rate was 82, blood pressure 120/70, temperature 36.8, and pain was rated a 0 out of 10 today. Alright, I'm going to start with your temporomandibular joint.
Okay.
Here, can you open for me? And close. Okay, no clicking or crepitus of the temporomandibular joint, any tenderness?
No.
Okay, no tenderness. I'm going to be feeling your muscles, temporal muscles, any tenderness?
No.
Your pterygoid muscles, any tenderness?
No.
Your masseter muscle, any tenderness?
No.
Okay, no tenderness of the muscles. Can you open your mouth for me? Put your jaw forward, pull it back, move it side to side. Okay, no decreased range of movement of the jaw. Again, no clicking or crepitus. All right, now have you stand up for me and turn around. Get your spine. All right, looking at your cervical, thoracic, and lumbar. Concavity is normal. There's no evidence of kyphosis, no visible masses or swelling. Okay. Looking at C7 to your gluteal cleft, spine appears straight and symmetric. There's no visible masses. I'll have you lean forward for me. Okay, you can stand back up. No evidence of scoliosis. All right, and looking at your shoulders, they appear symmetric. Again, no visible masses, and your iliac crest appears symmetric. With standing, I'll have you lean forward. Okay, and symmetric while leaning forward as well. All right. Okay, so now I'm going to be feeling your spinous process. Let me know if you have any tenderness with my touching.
No. No. And no.
Okay. No tenderness of the spinous process. No step-offs felt either, no swelling. All right, now I'm going to be feeling your cervical facets. Any tenderness?
No.
Okay, no tenderness of the cervical facet joints. No swelling or masses felt. I'm going to be feeling your paravertebral muscles now, and tell me if you have any tenderness.
No. 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 No.
Okay, no tenderness of the paravertebral muscles, no knots or spastic felt. Now I'm going to be feeling your sacroiliac joints. Any tenderness?
No.
Okay, no tenderness of the sacroiliac joints, no swelling felt. All right, I'll have you turn around towards me now. Okay, testing range of movement of your neck. We put your chin to your chest. Flexion is good. Look all the way up for me. Extension is good. Look to the right. Look to the left. Okay, rotation is good. Right ear to the right shoulder. Left ear to the left shoulder. Okay, lateral bending is good. Any tenderness?
No.
Okay, range movement of the neck is normal. There's no decrease. It's easy and gliding. I know tenderness was reported. Now testing range movement of your spine. I'll have you touch your toes. Good. Lean all the way back. Great. Turn to the side, one side. Turn to your other side. Okay, rotation is good. Lean to your right side and lean to your left side. Great. Any tenderness?
No.
Okay, there's no decreased range of movement of the spine. All movements are easy and gliding, and there is no tenderness. All right, I will have you sit down for me. Or, I lied. I'm gonna look at your shoulders, sorry. Okay. Shoulders appear symmetric. There's no visible bony deformities, swelling, or masses seen. And I'll have you turn. I'll look at your elbows. I'll be flexed to 70 degrees. Okay, other arm, looking at your epicondyles. Okay. Elbows appear symmetric, there's no bony deformities, no masses or swelling that are visible. Maybe look at your hands. Okay, hands appear symmetric. Again, no bony deformities that are visible. No masses or swelling that are seen. Fingers are relaxed. There's no contracture. Maybe flip your hands over for me. Palms are normal color. Again, no masses are seen. And with the shoulders, I'll return again for me. The shoulders, there's no muscular atrophy that is seen. No unilateral elevation or flattening. Okay, I'm gonna start palpating, starting with your sternoclavicular knot or joint. I'm gonna move across your clavicle until I reach your AC joint. Okay, I'll return. I'm gonna trace your scapula, your acromion process, the AC joint, and your coracoid process, or your acromion, tracking across your acromion until your AC joint and your coracoid process. And then there's your greater tubercle. Any tenderness?
No.
Okay, no tenderness. Felt on throughout the shoulder. No bony deformities, swelling or masses. Have you turn for me? Okay, have you get your elbow, feeling your medial and lateral epicondyles. Any tenderness?
Nope.
Okay, same with this side. Any tenderness?
Nope.
Okay, no tenderness of the elbows, no bony deformities, swelling, or joint abnormalities felt. Looking at your hands, feeling your distal, radial, and ulnar joints. Any tenderness?
No.
Okay. Your carpals, any tenderness?
Nope.
Your metacarpals?
Nope.
Your metacarpal phalangeal joint?
Nope.
Proximal?
Nope.
Interphalangeal joint and your distal interphalangeal joint?
Nope.
Okay. I'm gonna look at your snuff box. Have you abduct your thumb out? Any tenderness?
Nope.
Okay, no tenderness of the snuff box. Hands have no bony deformities, no swelling, and no tenderness is reported. So now we'll test range of movement. I'll have you raise your arms for me, and now over your head. Okay, flexion is good. I'll have you put your arms all the way behind you. Extension is good. Raise your arms out to the side and overhead with your palms up. Okay, abduction is good. Across the front. Adduction is good. Raise your arms to shoulder level. Bend your elbow and rotate backwards. Okay, external rotation is good. Now place one arm behind your back and try to touch your shoulder blade for me.
Gotcha.
Now the other side. Great. Internal rotation is good. Any tenderness? Okay, shoulder range movement is not decreased. All movements are easy and gliding, and no tenderness was reported. All right, now I'm going to test your elbow. Bend your elbows for me. Flexion is good. Straighten them. Extension is good. Turn your palm up. Supination is good. Palms down. Pronation is good. Any tenderness? Okay. No decreased range of movement of the elbow. Movements are easy and gliding. No tenderness was reported. Now I'm going to have you bend your wrist down. Flexion is good. Wrist up. Extension is good. Hand flat and facing down. Move your wrist towards your body. Radial deviation is good. Not away. Ulnar deviation is good. Any tenderness? Okay. No decreased range movement of the wrist. All movements are easy and gliding, and no tenderness was reported. Now testing your thumb. If you touch your thumb to your pinky, okay, flexion is good. I'm gonna pull it away. Extension is good. Now move your thumb away from your hand. Abduction is good. Now bring it to your hand. Adduction is good. Now touch your thumb to all your different fingers. Okay, opposition is good. Any tenderness? Okay, no decreased range of movement of the thumb. All movements again were easy and gliding, and no tenderness was reported. Now have you make a fist for me. Okay, flexion of the fingers is good. Straighten them out. Extension is good. Spread them apart. Abduction is good. Bring them together. Adduction is good. All right, any tenderness? No decreased range movement of the fingers. All movements were easy and gliding, and no tenderness was reported. Okay, now moving on to your lower extremities. Lower extremities appear symmetric. There's no visible bony deformities, swelling, or any abnormalities that I can see. I'm gonna feel your hips now. Any tenderness with me touching?
No.
Okay. No tenderness when palpating the hips. No warmth is felt. No bony deformities are felt. No swelling. Okay. Now have you sit down. I'm going to palpate your knees. If ideally we would have you sitting in a higher chair with your knees dangling so you could be more relaxed, but since we don't have that, we will just pretend. I'm going to feel your knees. Any tenderness?
No.
Okay. Any tenderness?
No.
Okay. I feel behind your knee. No masses felt. No masses felt behind the knee. Popliteal pulses are 2+ and equal bilaterally. I'm going to feel your ankle, starting at your ankle joint. Any tenderness?
No.
Okay, moving around to your Achilles. Any tenderness?
No.
Okay. I feel your medial and lateral malleoli. Any tenderness?
Nope.
Okay. Feel your heel, your calcaneus. Any tenderness?
No.
Okay. I'm gonna feel your tarsals and your metatarsals. Any tenderness?
Nope.
No tenderness with the ankles or the feet. No swelling is felt, no warmth or any bony deformities. All right, I will have you move over to the couch. We'll test your range of movement of your hips. Remove the kitty. Have you bring your knee to your chest.
Knee chest.
Okay, flexion is good. Now you straighten it back out and then lean it over the side of the table. Okay, extension is good. Okay, I'm gonna reach across to your right hip and I'm gonna take your left leg. Okay. Abduction is good. Adduction is good. Have you bend your knee? Internal rotation is good. External rotation is good. Any tenderness with any of that?
No.
Okay, no decreased range of movement of the hips. All movements were easy and gliding and no tenderness was reported. I will have you stand up for me. We'll test your knees next. Have you raise your knee. Flexion is good. Put it out. Extension is good. I'll have you sit down. Okay. medial and lateral rotation are good. Was there any tenderness?
No.
Okay, no decreased range of movement of the knee. All movements were easy and gliding and no tenderness was reported. Now moving on to your ankles, I'll have you stand up for me. Walk towards me on your toes. Without hitting your head. Alright, turn around, walk on your ankles, or on your ankles, your heels. Okay. Alright, any tenderness? Okay, no restricted range of movement. Movements were easy and gliding, and no tenderness was reported. Alright, I'm also going to have you walk towards me normally. Test your gait, and I'll walk back. Okay, gait is steady, with no hesitancy. Width of the base is about 3 to 4 inches, which is normal. Okay, now we'll finish testing your range of movement with your feet. Have you sit down for me. I'll have you point your, test dorsiflexion, plantar flexion. Okay. Rotate. You wiggle your toes for me. Okay, perfect. Okay. Forward abduction, adduction, flexion, extension of the toes were all normal. Any tenderness? Okay, there's no decreased range of movement of the ankles, feet, or the toes. Movements were easy and gliding. And no tenderness was reported. And that concludes our focused exam.
Thank you.